that March 1st. That was the plan. Back to my brother, it sounds like it's gonna be so.
Sounds like a big scene.
And, you know, my brother is probably shocked just as much as she is. But this,
Thank you, Mark. Hello. Hey, Linda, what's up?
Well, we are planning for his birthday lunch on Saturday, and wants to go to
Okay.
and I am going to call them for.
I've witnessed that. I've been to California 3 times in January for like 5 days stay at that hotel. And my brother says just go with the flow. Yeah, just go with the flow. You know what I'm saying? Just go with the flow. She's like, here, showing a picture. This is my brother, right?
Well, Sunday will be better for us.
Brother.
Me and I are going out of town on Saturday. Yeah, we're meeting ourselves for lunch.
Yeah, I've got, you know, I've got something in mind too. He said 4 kids. Wow. So, I mean, as I just left
We're not,
the other day, I don't have to be able to make it.
Your pancakes, frisbee sauce.
It's just hard. This is.
Yes, we are. We do. We'll probably be going to that Smithfield Station restaurant in the hotel that we've been to several times. It's really nice. Okay. Sounds good.
Yeah. Very scary to listen to this. The last thing I want to do is see my house, you know what I'm saying? Because my brother, a month later,
So what's going on? Oh, it's that lady. I'm about to right now. Okay.
He goes, I had to go change the paint. I saw 4 cars. Really? Going down the road, car. He came over, right in front of the house, he slammed the brakes. Then the guy from the right comes on the right. I don't know how in the world we didn't get hit, either the left or right, in front of the shit. I have no idea. And if that would happen, it would rear ended too. The rest are crazy driving. 64 is always bad, right? This one's there. Always bad. Oh, no. Well, anyhow, this morning I got a couple of bad. Did you know that was wrong? Almost like the bad. So anyway, first time we talked, very, oh, yeah, yeah.
In the box, brown box. Thank me for having to explain.
No, I haven't done anything.
Yeah, of course, I didn't know we had all brochures, they just showed up. Yeah. So I just, and do you know about the Spanish guys that are in Spanish, the art guys that are in Spanish? We have a Spanish speaking band that's in this area. There it is. So, but there's no, yeah, well, they're in France. Yeah, I think I've seen, yeah, looks like you got it.
Yeah, good.
Yeah,
It was something to do with. I'm trying to explain to you what's going on.
Yeah, that's great. If they can do it, then it's fine.
the way, we enjoyed the BC.
Yes, oh good, I'm glad you made it out. Good,
Yeah.
Mannequin and practice. Rush coming through the door.
yeah.
Right. It's more easier.
Yeah, I'm wondering what
Yeah.
they do.
How much you had.
Right.
One person had to-
Right.
Good for us.
Yeah, I love Michelle.
Yeah, yeah.
Fantastic person.
Yeah, she's
Does a great job.
she really is.
And Marcus, let me see what Helen knows.
Oh, yeah.
I know about that.
Yeah.
Does he visit people?
He does, and he kind of wears two hats. He volunteers with CSN, and he also volunteers with the Phoenix Society, which is of burn survivors. He's a burn survivor, so he goes and visits our burn patients as well as trauma.
Does he do any volunteering at Shifflett Mall?
He does.
He
I
looks
think he
familiar.
knows who you have a guy that goes out to walking farms. Dennis. He knows Dennis. We talked about that last night. Yeah. Yeah. Yeah.
It's been like a.
And then, I remember, we come home after the construction, after one guy cut me off.
Everything okay?
Really bad. He's like coming over here. I get home like one thing. My hands and knees fucking full.
Same demographic.
Starts out with a green.
Yeah. Well, that's typically for heart stuff. That's where you're gonna find your folks. Yeah, that's nice.
That's what I was wondering.
I get the
Like you said,
60s, 70s.
They tried to do the whole thing. No, no, it was a special. Only made so yeah, a special fire, only made so many of them. I keep that.
Hey, when you've got a good point.
Yeah. You tell me. I mean, yeah, 5 minutes or so. Was that about right?
Usually 30 minutes presenting, and like 15 minutes.
We'll set Ron's ready to go.
Or you can go. And then you don't have a problem with that.
Yeah.
When I get everybody's questions answered.
Yeah, I'll run through slides for 20 minutes or so, and then I'll get to the floor.
Like that? Sounds good.
Okay. We recite the Lord's Prayer at the very beginning, and then I'll welcome together. I'll put a few thoughts together from what we see how things.
I like it.
I would love narrative to it, and then I'll
Vice, no, like, I talk about the person, stuff like that.
Sounds good.
Okay, everybody, welcome. We'll begin with the Mended Hearts Prayer. There should be a copy near you. Everybody have a copy? Anybody need a copy? We ask for your blessings, Lord. We ask for strength that we may pass it on to others. We ask for faith that we may give hope to others. We ask for help that we may encourage others. We ask, Lord, for wisdom that we may use all your gifts well. I appreciate everybody coming out on a chilly night. We have a very interesting speaker. I think you'll find the information that she has to give you important, because all of us certainly those of us who have had open heart surgery, we know what trauma is. We've been there. And those people who are visitors, every time we visit, we go into the IC unit and we see the people who've undergone trauma. So tonight's meeting, I think, will be eye-opening for many of us. I would like to introduce one visitor that we have with us, and I didn't get your name, I'm sorry.
Melissa.
Melissa, and last name?
Penman.
Penman. This is Melissa Penman. She was a heart patient at Chippenham, and she was visited by one of our visitors, and so we welcome Melissa.
Sorry, it's been over a year since I've come to visit.
That's okay.
I wanted to start meeting some more people that have the scar, so.
Yeah, well, we got it. We got it. Welcome to the group. Appreciate it. Anybody else here? I don't see anybody new. Okay. Some of us here are a community of patients and survivors of traumatic heart surgeries who come to a group like this for support, knowledge, and education. We're lucky to have in this region VCU Health. They're a full-service provider for all sorts of patient needs. And the important fact is that VCU is ranked as a level 1 trauma center. They have the worst of the worst. They have the MedVac program. The lady that we had from VCU Health that talked about freezing the brain in cardiac arrest patients. You know, VCU Health really provides us with so much expertise. Certainly in terms of speakers, we would be lost without VCU Health. And so we're very appreciative of people from VCU Health that come to be with us. They treat burn victims. They treat people who've been in road hazards, construction accidents. They're all mangled, and VCU can put them back together again and set them on a road to recovery. But what happens after a patient leaves the hospital? The same will be true for those of us who've had open heart surgery. While we're in the hospital, we learn how to dress so that we don't pull against the incision in our chest. We know it's been drilled into our head. You can't lift any more than 5 pounds until you see your surgeon a month after you leave the hospital. And then, you know, for support, we have Mended Hearts visitors, and we have the total organization that meets once a month for education and more knowledge about heart disease and living a full, active life with heart disease. But people who've undergone a very, very traumatic, let's say, car accident where they were burned, they really need something beyond the physical recovery that they're going through. They need that emotional support. And I was unaware that VCU had a trauma network until Joe told me that he had spoken to our speaker this evening, and I am just impressed. I did some reading on the VCU website about what the trauma network was all about, and I'm just ecstatic to introduce to you Ms. Kara Shifflett, who is the Trauma Center Coordinator for VCU Health. Thank you.
Can you just come with me everywhere I go and introduce me? That was lovely. Thank you.
Well, thank you.
I'm so glad to be here with you guys tonight. I am Kara Shifflett. I am the Trauma Survivors Network Coordinator at VCU Medical Center downtown. And I also am the Trauma Outreach Coordinator. So I'm a nurse. I've been a nurse since 2007. I've got a background in emergency medicine, primarily at kind of different community hospitals across the state. This is actually my first experience at a level 1 trauma center. I've been with VCU now for, I guess, going on 3 years. And my role as a trauma outreach coordinator, I am responsible for a lot of the follow-up and education that we do with the community, with other hospitals across the state. that send us trauma patients. I review each one of those cases and go back to them with feedback and opportunities for improvement or, helping them out with trauma care. But my favorite part of my job is the Trauma Survivors Network. So, make sure this is not going to go off again. Oh, there we go. Sorry, hold on. There we go. So, Trauma Survivors Network is a national organization. We have a chapter of it at VCU. All level 1 and level 2 trauma centers, so kind of the top and second tier of trauma centers across the country are required to incorporate TSN into their trauma programs. And essentially what it is it's a framework for providing emotional support, coping mechanisms, peer support for trauma patients after injury as they leave the hospital and kind of go back to their new normal, I guess, or whatever that looks like for them. So every hospital does it a little bit differently. At VCU, we have a network of folks that help with Trauma Survivors Network. It's all volunteer based. I'm the only paid person, and again, it's just a small part of my job. But it's mostly run by volunteers. This is actually one of our patients, caught him on his way out for being discharged. He got shot several times and spent I think about 6 weeks in the hospital with us, and this was his discharge day. So I had a little table set up in the lobby, and he was on his way out the door. So what does trauma look like? And I know you've made a great connection between, open heart surgery and trauma. Really, one is kind of an accident, if you will. You don't expect it, and the other one you do a little more preparation for, and you know that you're going into the hospital to have surgery, and it's a little more planned. But overall, it's all a very similar experience. You're in the ICU, you're in and out of the operating room, you have many, many teams of patients caring for you kind of under one umbrella. You've got family to contend with coming in and out that are worried, who's gonna tell mom what's going on, how are the kids gonna handle it, all that stuff. So anytime there's trauma, you have all this stuff that goes along with it, right? And now after this has happened, how are we gonna go back to life? How are we going to go back to work? How are we going to go to social functions? How are we going to deal with the holidays? How are we going to tell our neighbors what happened? How are we going to answer the same questions over and over and over again? PTSD is something that, maybe up until the last several years, you hear PTSD and you think, oh, military vet. Nobody took that term and pushed it beyond that kind of a setting. But now we really are practicing what's called trauma-informed care. So we do that across the spectrum. We think about, patients coming into the hospital, whether they're a heart patient or a trauma patient. We think about them coming in with a story already when they get to us, right? You guys have been patients and you have a history beyond needing heart surgery. Things have happened to you in the past. You've maybe been in an accident before. You've been hospitalized before. So you have all these preconceived notions of what the hospital is going to look like, what your stay is going to look like. And that affects how you are when you're in there, right? It affects your stress and your anxiety and all the things that you feel. And then you have to deal with this new thing that's happened, right? You've had a trauma. So now, again, what does that look like going forward? So we find that after the first year of an injury, 21% of trauma survivors developed PTSD and 23% developed depression. Now, we talk about PTSD and depression in two different categories. You can have both, certainly, but PTSD is the kind of flashbacks and memories that pop up and anxiety that surround an event. Depression is kind of the more subdued symptoms, like the kind of hopelessness and the sleeping and those kinds of things that go along with feeling depressed. And PTSD and depression is not just for patients. It's for caregivers, and it's actually significantly more for caregivers. Up to 40% of caregivers develop PTSD after a loved one going through an injury. So if you think about that person that's lying there in the bed, their mom or their daughter or their brother or whoever is standing at the bedside day after day after day, providing care, giving up their life, seeing their loved one incapacitated, that person is going to develop PTSD. So you guys, as peer visitors, or what's your term? What term do you use?
Accredited visitors.
Accredited visitors. See that, I'm sure, and I see that. I go into rooms of, 20-year-old kids or 65-year-old people that have been in motor vehicle crashes, and their loved one just looks like they are a shell, and they've been standing there, they haven't eaten, they haven't slept. So you guys are probably helping the family just as much as you're helping the patients. I'm sure you've seen that. So recently, actually just as recent as the last 6 months, we have started incorporating screenings for PTSD and depression into all of our trauma and burn patients that come to VCU. So if you come after a traumatic injury, we'll ask you some questions. It won't tell you that you have PTSD or depression because a lot of those symptoms can't really be fully unraveled, and we can't diagnose those illnesses until at least a month after the accident. But we can tell you that you're at an increased risk for it. So if you're at an increased risk for either one, we can give you some resources. We actually have a whole trauma psychology department that will come and do a consult. We've got social workers. There are resources out in the community. We'll make sure that you have help once you leave to kind of work through all that stuff. This is one of my favorite pictures. This guy in the bed is one of our patients who is also a gunshot wound victim. And the guy standing up beside him is one of our medical student volunteers that helps with Trauma Survivors Network. So this patient has kind of a sad story. He's 20 and he has been in the foster care system pretty much his whole life, and even at the age of 20, he's still in the foster care system. They won't release him. He's from a different state, and they won't release him until he turns 21 because of some legal actions or something that had happened. So he was with us. He's paraplegic. He got shot through his spinal cord, so he can't move anything from the waist down. And he ended up unfortunately getting stuck in our hospital for the better part of about 2.5 months because there was some things that happened with Department of Social Services and trying to find him a placement for an inpatient rehab facility. And they wouldn't release him, and it was just kind of this whole disaster. So he ended up in this room by himself for about 2.5 months. And at the age of 20, that's got to be pretty rough. He didn't have any family, no friends. He's from out of state. And he was kind of crotchety, and the nurses probably got tired of him because he was kind of crotchety. And a lot of that was just his coping mechanisms of wanting to have everything exactly the way that he wanted it. So he was controlling and made it kind of hard to take care of him. But we found out pretty early on that he liked to play chess. And so our medical student volunteers would go up with him. There were probably 4 or 5 of them that would go up and play games of chess, and they actually started this whole tournament the whole time that he was there. And so this is like one of my favorite memories because I think like he would smile, and that was the only time that anybody ever saw him smile was like during these chess tournaments. So that was kind of a cool story. Yeah. So Trauma Survivors Network is kind of it's a result of realizing that our patients have PTSD and they have depression and it's not just an acute injury that we're treating, we're dealing with what happens after. So the whole idea here is to provide support, right? And we do that through things like playing chess. We do that through support groups. We offer, I'll get to some of that in a little bit, but we offer support groups both in hospital and kind of after you go home. And then the best part of our program are our peer visitors, just like you guys. So we have kind of a core team of peer visitors who come to the hospital and make those connections with patients and families while they're with us. This is just the website if you guys want to check it out. It's the American Trauma Society is the national organization that sponsors TSN. But it's a nonprofit. You can, as a patient or a caregiver, you can actually go on here and make an account, and it kind of gives you back-end access to some extra resources, some discussion boards, ways that you can connect with other survivors. And then you can search for each individual hospital. So if you're from out of state and you want to see what your local options are for TSN, you can look that up, find your local hospital, and see what they have to offer. So at VCU, Again, like I said, our peer visitation program is my favorite. Right now, I've actually got Kirk in the back, who I will formally introduce in just a minute, but he is our longest veteran, I think, at this point of our TSN program. And we have 3 others in addition that come and volunteer their time. We do biweekly rounding, so we have our medical student volunteers. Right now, we actually have close to 70 first and second year medical students that help with various things, but one of the things that they do is to visit patients' families and pass out goodies, toiletries, information on TSN, on the hospital, kind of ways that folks can get connected. Support groups, we do once a month. They're actually not in person anymore, they're virtual now, sorry, old slide. But we do virtual support groups, and that's for anybody, families, caregivers, patients that have been discharged. And then our snack and chats are an in-hospital, just kind of social hour. It's a way that current families mostly, but we do open it up to patients that are able to leave the room, can come and just kind of have a snack. We'll maybe have an art activity, or we'll have a chaplain come, or we have service dogs that come, so once in a while we'll bring in the dogs, let them come get some puppy love. So we do that once a week on our surgical trauma ICU. And then National Trauma Survivors Day is kind of the day that we celebrate just giving back to our trauma survivors. This year we're actually planning an in-person event, which I'll make sure you guys get invited to if you want to come, but it's going to be at the Richmond Kickers at City Stadium. They're starting a women's league this year, and so it's the women's opener game. So we'll be out there to celebrate our trauma survivors. So that's kind of what we do specifically at VCU. At the national level, as I said, they've got that website that you can find resources. They offer a Next Steps class, which is a 6-week kind of self-directed, but with a live component class that talks about, again, that getting back to normal, figuring out, how you're going to go back to work, getting help with disability, and then a lot of it is really just journaling your thoughts and your feelings and working through kind of some coping mechanisms. So you guys could tell me this slide, I'm sure. You could tell me all the wonderful things about peer visitation, and I know, at least I hope, that you see the benefit of it every time that you go visit a patient. I hope that it's very rewarding, because I definitely see that with us. You guys have just a unique perspective. You've been in the bed, you've had the surgery, you've been at that hospital maybe, you've maybe been in that room, or, so I think, definitely you offer a perspective that we as healthcare providers cannot replicate. We can have all of the empathy in the world, but you can't really have empathy unless true empathy unless you've walked in that person's shoes. Kirk will talk about some of the things that he does to, just get to know people and kind of provide the tricks of the trade, as you will, that, things that helped you survive. You talked about the gown, so it doesn't pull on your stitches, things like that maybe we as nurses overlook, right? So, and then it's just positive, because you're in bed. In fact, a personal story, Kirk visited my dad. My dad is a burn survivor. He got burned over 40% of his body, burning brush about 3 years ago. And he was at VCU. It was actually right before I started working there. And I remember, even as a nurse, and the daughter, it's like, you're switching roles, you're still maybe trying to be the nurse, but you're having to be the daughter. And, juggling my mom. And again, we talk about caregivers kind of having the most PTSD. Watching my mom struggle through that was harder than watching my dad go through everything physically that he went through. And then Kirk came in, and, immediately they kind of found common ground, and, he knew the area that my dad lived in and could kind of say, yeah, I remember what that was like. And they just had this conversation that he still remembers. So, again, it's just a very nice perspective that's positive. And my dad is like, okay, well, there's somebody that got burned worse than I did, and he's up walking around, So, it makes you feel like there's hope. These are some of our medical student volunteers. This is actually a great opportunity for them as well, because they form a little leadership team. They call themselves the co-presidents. There are like 4 co-presidents every semester. But they do their own schedules, they handle their own training, you know, with some guidance from me, but they're just shiny and new and very excited to be there. And it's really the first time they've had any face-to-face patient interaction. They're still in their first or second year of medical school. They haven't even really set foot inside the hospital yet. So for them, getting to go in rooms and talk to patients is just like very exciting. So they really like it. This picture here, these are some more of our medical student volunteers. How many of you are familiar with the doorways? You can tell. Yeah. So the doorways, for anybody who's not, is a very special and amazing place. It is similar to a Ronald McDonald House, if you guys know what that is, but it's about 5 blocks from VCU. And it's actually in an old Days Inn hotel building that dates back to, I don't know, the 50s probably, something like that. And it's one of the sky rises that has, you know, open balconies that are 15 floors up, and you're walking along the outside balcony to get to your room. But they have converted it into a 100-bed hotel for families and some patients. They get a lot of transplant patients that are from out of town and folks that need to be here for a long time. But it's free. I think they ask for like a $15 a night donation if you can. They have 4 huge kitchens in there, and they get all these food donations so you can cook meals for yourselves. They have social workers that volunteer to help with different things. So one of the things that we do through TSN is go to doorways about probably maybe 4 or 5 times a year and cook a dinner and share information on TSN, but you know, feed a lot of our families of trauma patients that are staying there. So that's kind of a cool thing. We talked about next steps. That's that online class. I'm gonna skip that. How did I get here? Hold on. Oops. I think that might be it. Let's see. Those are all not necessary. Yeah. So, do you guys have any questions about that? Yes.
On a few slides back, I saw, I think it was Traumapedia.
Uh-huh.
Is that similar to like Wikipedia?
It is, and it's kind of vetted by, you know, by medical folks, if you will. So if you sign up for that TSN website, you get access to the Traumapedia, and it's one of the things that we pass out is a handbook for patients and families. When I first started, it was probably 60 pages long, and it had a Traumapedia inside of it, and it went into, you know, what does it mean to be intubated? What is a tracheostomy? What is a, you know, what is this surgical procedure? Like different names for different things, and going over every bit. I decided it was a little too much, and I decided, since most people are sitting there on their phones, you know, the online Traumapedia is great. It seemed a little bit overwhelming, but definitely it's a great place to find resources that are very specific to trauma and very easy to understand, for sure. Yes. Yeah.
I'll go back to the post-traumatic stress disorder.
Yeah.
I retired from law enforcement, and law enforcement, fire departments, and rescue personnel see and deal with stuff that combat veterans deal with.
Yep.
And you never get over it.
You're right. And in fact, those statistics that, you know, 20 to 40% of caregivers, 23% of patients, if you look at rescue personnel, fire and rescue, they're up close to 30%.
Yep.
And really, it's like they've actually done surveys to show, you know, folks that have been in fire and rescue, they'll survey them after the first year, and they'll say, you know, have you seen something at work that has been distressing enough for you to think about it, you know, days and weeks later, that have kind of kept you up at night, that sort of thing. And like 95% say yes in the first year.
I'll also say I spent many nights in the emergency room at MCB with a variety.
I'm sorry.
But people have no idea. Everything that you can imagine and some you can't imagine comes in that emergency room down there.
Yes.
All night, every night.
Yes,
so.
It gets pretty rowdy down there.
Yep.
Yeah, it does. It does. And I mean, sometimes even I feel like it's traumatic for patients that are there for something else, and they're seeing all that going on, you know? I mean, it is not a very restful, relaxing place to be most of the time. So, Yeah. Anybody else have any questions?
Do you have psychologists or psychiatrists that work with severe trauma patients adjusting to life post their experience in the hospital?
We do. We have a trauma psychology team. I say team. Right now there are two. One of them is out on maternity leave. She actually may be having her baby as we speak. She is. Well, the two of them are just absolutely amazing, and they're psychologists that specialize in physical trauma. So they don't see any other patients in the hospital, only patients on the trauma service. They also have an outpatient clinic. So, and that is something that they're trying to expand. That's why they hired the second one. So once this other one comes back from Babyland, they'll kind of expand that a little bit more. But they do see a significant amount of patients outpatient. And they're also pretty good at referring to other providers in the community that specialize in trauma. I will say they're not a lot, and I will say, as I'm sure you all know, mental health services are severely lacking everywhere. But, you know, in this area, they are severely lacking. It is very hard to find mental health support. If anybody has ever tried to find a therapist, to find a psychiatrist, it is almost impossible, even with the best insurance. So we definitely run into that, which I think is why organizations like TSN and like Mending Hearts are so important, because it fills that gap a little bit, you know, and it takes some of that pressure off if folks have an outlet. If they know, oh, well, there's a support group, I can go to this, or I can call up, you know, Joe, he came to see me, or, you know, if they have that kind of lifeline after discharge, I think that fills a very important void that is missing in our system. So, yeah, good question. Yeah.
You mentioned that there's support both inside the hospital as well as outside the hospital.
Mm-hmm.
Now, I was wondering, as far as outside the hospital, are there groups that get together kind of like we do here?
I wish. I mean, other than our support group that's virtual, not really. I know if you get very specific, there are. So there, for example, one of our peer visitors, like Kirk, is an amputee. She lost her leg in a motorcycle crash. There is an amputee coalition in Richmond that you can join. There are a lot of support systems and groups for traumatic brain injury, spinal cord injury, that kind of thing. So once you get to that point, if you really delve down to the specific injury, usually we can find that kind of community. But TSN as a whole is more of a blanket and more of a, you know, helping to point people in the right direction. So, okay, you're a new amputee, let me point you to this coalition. Or, oh, you're a new spinal cord injury, there's this group over here. So I think we're kind of the concierge of trauma support.
It's a good resource for your patients after the discharge.
Yeah.
To know that there's still an organization they can go to for further support.
Yeah.
Just like Mental Hearts.
Definitely, yeah. And a lot of folks, you guys are probably familiar with Sheltering Arms, our inpatient rehab hospital.
Right.
So they're even better at plugging folks in. They have something that's similar to TSN, but they've built it themselves, and it's very robust, and they do a very good job. So if they're severely injured enough that they need to go to inpatient rehab, there are a lot more services once they get there. So, yeah. Cool. Well, I would like to introduce Kirk, and I'm going to do that by playing a little video for you guys so that you can see what he has been through. Let's see. Bigger.
was taken to MCB West Hospital emergency room and later to the burn unit, where I spent 9.5 months. I saw that no matter how bad I may have thought that I had it, I learned very quickly that there's others that have it worse than I do. About 4 years ago, I became reconnected with some people on the burn unit, on the staff. They were going to get a program here where they were going to train former burn patients, burn survivors offering assistance in recovery. The light just kind of came on. The fact that it's been 35 years since I was burned, how I made it to where I was, needed to be shared with someone else that was beginning the same journey that I'd been on. And sharing that with someone else is an amazing thing. We find out through the nurses, or whoever's the caregiver at the time, how the person's doing that day. They say that we have a volunteer here that's been through what you have, a burn survivor, and they want to know if you'd like to meet him. I gown up with the gown, the gloves, and I come in and I basically introduce myself, more or less give them the understanding that I've been where you've been. And I will, if they ask, and I can, I'll take my gloves off where you can see obviously my hands have been burned. And the arms. When a patient sees that you are comfortable with yourself, it begins to lay the groundwork for letting them feel comfortable with themselves too. Through horrific tragedy and much pain and suffering, I learned I was given a gift, a second chance in life, the gift of survival. And the best part about having this gift, this precious gift, was being given the opportunity to share it with others. And that is what made this gift priceless.
So, Kirk McClure.
Hello, everybody. Now I don't have to introduce myself. You already know who I am. Forgive me that always gets me. It always gets me. First thing I want to say is I love your motto on here. It's great to be alive and help others. As you saw up here, part of the from the group, the Phoenix Society for Burn Survivors, who I was affiliated and trained and screened by before I started doing this at MCB, as we call it, which is now BCU Health. Their motto is nothing heals people like other people. The second thing I wanted to tell you is, while I don't mind speaking in front of groups, I've spoken at burn conferences in front of 500 people. When I have to stand up in front of about 14 people without 15 people without a podium in front of me, the first thing I'm thinking is, geez, I hope my zipper's not down. But I did check before I got up there, so I'm pretty sure it's not. Of course, at any time, and open to questions, because this is when I'm speaking, it helps me from not really having to explain a whole lot. There was 9.5 tough months there. Fortunately, this fire that I was in was on New Year's morning, 1981, so I'm a 43-year burn survivor. It's important to us, the survivors, as you well are, as you will hear people refer to sometimes as being burn victims or trauma victims. I'm not a victim no more than any of you are, or I'm a survivor. And it's very important. It's one of the first things we want to convey as a volunteer when we're seeing a patient. No, you're a survivor. And one of the second things that I like to do with a patient is get them to smile. I know all of you are volunteers, am I correct? And you see patients, is that?
The red vest.
Okay, most of you are. So I'm not going to stand here, and tell you how to do your job. Tell them some of the things that I do. Is that when I go see a patient, one of the first things I'll do is I'll confer with, as Kira alluded to, the trauma psychologist We interact on seeing patients. They'll come see me. I'm there on the burn unit in critical care hospital. I originate from the burn unit, which is on the 8th floor of the critical care hospital, and 1 floor up is STICU, surgical trauma ICU. That when I have time to do that, I will also, through TSN, Trauma Survivor Network, I am a peer visitor, and that's just the title. We're doing the same thing, and through the Phoenix Society for Burn Survivors, I'm a SWOR volunteer. VCU Health got this grant. As they alluded to here, I was invited to an annual Burn Survivor Sunday that they have down there by a friend that was a former firefighter. He was retired, and as many firefighters do, they run catering companies. And I was at, because they love to cook. And I ran into him at church one day. I said, "Hey, Frank, I think I'm going to come over and see you later." He said, "No," he said, "I got a gig downtown, a catering gig." I said, "Well, what are you doing?" He said, "I'm doing a Burn Survivor Sunday." He said, "Haven't you ever been?" This was probably in 2012. I was still working at the time. And I said, "No, I've never been to this before." He said, "Come on down, I'm going to tell you where to park." And it was at the Alumni House. They had open mic. Someone asked me if I'd like to get up there and speak, and I haven't shut up since. I was told that they were working on getting a grant through the Phoenix Society of Burn Survivors, which is worldwide, to start this program here. They couldn't just say, "Come in and talk to patients." You've got to be screened or trained. And when I say screened, because sometimes, because of other things like PTSD or emotional insecurities, you're just not ready to see a patient, because it's hard to put it this way. If you're looking for something for them to make you feel better, it's not time. It's like you really need to have something that you can give back to them. And where they alluded to in the film, I said to people when they came in and trained, they called me. As a matter of fact, 1 month after I retired, we got the grant. So I barely had time to start watching The Price is Right, which, God help me, I didn't want it to. And I started working in the program down there, and they trained me, and they said, I said, "What am I going to do? It's been 35 years since, I was burned." And they said, "Precisely. You walk in, you're obviously comfortable with yourself and talking with people, and your countenance and your confidence, and convey that with someone else. What we want you to do is share strength and hope through your own experience with other people." And it's an amazing thing. It is, not to be redundant, it is an amazing thing, because once you get in there, things just start to flow. Oh, we're going to know, as you will, when you go in, if someone doesn't make eye contact with you, you drop your card on them. You say, "Hey, I'll come back and see you another time." But sometimes they want to know all about you. They want to know. And a lot of times with trauma patients, I'm burn trauma, but I see falls. MVCs is what they call them, motor vehicle collisions instead of motor vehicle accidents. That's just the medical term down there. And I get those assignments from Kira. On the burn unit, I just walk in there and they give me a piece of paper, and I'll decide who I'm going to go see at the list of patients. They are in the burn unit usually a lot longer than they're in STICU, one upstairs, because that is high volume or high level trauma. And their step down is over on main 9, main 11 is orthopedic, like that. But when they're just there and they're critical, what is the average time? 2 or 3 days, if that much, on STICU. The burn unit, I was in there 9.5 months. I've seen, and I was burned 55%. Basically, this was waist up. Everything on me looks like this is 3rd-degree burns and had to be grafted. My face was 2nd degree. They took donor sites where they can take your skin to put them on their legs down. I have seen things I will never forget, but successes that I will never forget. When I was burned, and they still do, they have an equation of age versus TBSA, which means total burn surface area. I went in there at 26 and turned 27 while I was in there. And you added 55% burns to that, and I was told if I was probably 5 years older, I might not have made it. One thing that I don't remember anything, I remember the night of the fire. I'm blessed that I've never had PTSD, which is very fortunate because I worked in industry in a powerhouse with boilers, incinerators, and furnaces for 35 years post-burn. So it's good that, you know, I've backed into a lot of hot pipes and gone, ow, you know, like that, but I haven't been put back in the hospital for that. I've had my ankle rebuilt twice, and I've had my hip redone twice. Same ones both times, and just parts wear out. Both of them were done 25 years ago, and I just had the hip done this June down at MCV. You know, you get old, parts, I'm 69, parts wear out. I didn't do it. They said, what did you do? And I said, I got out of bed. And then when they took me in there and x-rayed me, it turns out the screws in the socket had disintegrated, and the socket inverted. And the surgeon looked at me, he said, how the hell are you still walking? And I said, because I want it. You know, it's, I don't know, there's something that I have. Not toot my own horn, something that you have too. We've got drive. We've got drive that other people need to know. They need to know about. There are people down there, as I was speaking of before, that with this equation, that would have never made it 43 years ago when I was in there. I have seen at least 4 or 5 people with 80% burns that are surviving. 80% burns, where they haven't been able to harvest their skin, take their skin from donor sites. They've had to take microbes of skin and grow it to be able to put on there. And they have walked out of that hospital. Currently I'm working with another one, another 80% person right now. One thing I do encourage early when I'm working with patients that are ambulatory, as the whole critical care hospital is, this burn unit is an ICU, intensive care unit. There's closed doors with rooms, all of them have one person in it, because patients can't interact in the rooms with other patients because there is an extreme high risk of infection in burns, called burn sepsis. I'm sure some of you people know about sepsis and infection of the blood system. That's what almost took me out of here. They called my parents twice. That they lived in Hopewell and said, you better get up here. I was on a ventilator, I was on life support for 6 weeks during that time, but I'm here, and I'm here for a reason. And I've got something that somebody else needs, and as long as I can take a breath, I'm gonna give it to them. I'm gonna give it to them. But these patients that I say, if you're ambulatory, that are in rooms with the doors that, you know, they close. And I said, if you're walking in the back where there's glass enclosed ICU rooms, upper level trauma, some of them are on ventilators, so they have them in induced comas. But some, because say a room in the front wasn't open, some are very awake, cognizant to see what's going on. And I encourage these patients that are ambulatory to stop and talk right at the window to them, or at least wave at them, because that patient sitting in there says, I'm going to do what he does, because that's what I did. And I try to let these people know, already you have something, you survived. Go walk that hall and give it to someone else. And that's about what it's, you know, what it's about. It's us being able to give somebody else something. Does anyone have any questions? Yes, sir.
How often do you visit VCU?
I'm down at VCU approximately 2 days a week. I've just recently gotten back into that because when it got to be where I couldn't get around well before, I got my hip surgery kind of postponed because there's so many of them. I didn't get it done until June, and I was walking with a cane from January until June. And I cut back to 1 day a week. Now, I also, as she mentioned, we have sheltering arms rehab. There is a part, everything's connected downtown MCV. And Shelter in Arms has been in different locations in the city. But they've had, like where I live in Mechanicsville, they've had day programs in there at Memorial Regional. 3 years ago, they built Shelter in Arms in Goochland, which is a Shelter in Arms Institute rehab facility, and it's overnight and it can be lengthy stay. And when they opened up, they started a program where I'm a peer visitor out there when a burn patient, let's say, lives alone, where you can't do your own burn care when you're getting out, or lives in a situation where they need a little extra. And a lot of times it's the people with those burn injuries that are way up there, or it's affected their ambulatory system, where orthopedic, like it did myself. They need that. So under the premise of VCU Health, they're affiliated. I can see patients out there. But for instance, I can't go. Now Chippenham has a burn center. I can't go to Chippenham. In the past, Centera in Norfolk and Martha Jefferson at UVA had burn centers. They don't now, and it's only VCU Health. As you can probably hear and understand, my bread's buttered on burns, but I do go to trauma. I don't call her as much as I probably should, but trauma is, STICU is twice as many patients, if not more. I mean, I don't know, how many rooms are up there?
Probably 30.
There's 12 on burns. Yeah. There's 12 on burns. So, and oftentimes burns, because it's an ICU, gets STICU overflow. So I have MVCs, motor vehicle collision patients, and I can see patients right there, So I kind of juggle them both. When you mentioned about support, Phoenix Society has it's a convention, but it's called a burn congress. It used to be every year, but since COVID, it's every other year. I just attended one with almost 700 people at the National Harbor in October. And one of my former, colleague, burn survivors that I worked extensively with was 85% burns attended. And another couple attended that came in before me that got involved with it. There are resources online and, through the computer, and they have these things everywhere. As she said, they haven't developed that because I wouldn't say the ATS, American Trauma Society, and Trauma Survivor Network are not in infancy, but they are just starting to build up to do that same thing. I've been doing burn visits for 9 years, trauma visits for 8 years, and I've been out at Shelter in Arms now for 3 years. And I'm going to do it as long as I can keep driving. And let me tell you a little something about nurses. My mother was a nurse, and she was active nursing, when I was burned. And many times, even my mother, bless her heart, she's passed now, but she knew more than anybody else, in the family knew, being a nurse, of how critical that I was. And she was there with my dad all the time. I ended up marrying one of my nurses, and she's retired now. So she says, now I can tell you, because she used to get mad. She said, because of HIPAA, don't be telling people that you married one of your nurses. She went on to work and ran, was a critical clinical coordinator in children's pre-op and recovery until they opened up CHORE, the new place down. They were preparing. Like 8 years ago, they took all the children out of the recovery room, which is called PACU, post-anesthesia care unit. And before they opened up the new hospital, that's where they were started to do that. And she did that until she retired last year. My mother was a nurse. She was a nurse. Her mother was a nurse, and her sister was a nurse. So I love me some nurses. Any other questions? Yes, sir.
Do you work with the families too? Because it seems like, especially a burn victim, they're in there a long time.
Yes, I did.
It's a real hardship on, I would think, the wife and the kids. And
oftentimes it is, and that's where our trauma support people come in, and especially social workers, and they come in. I get directed staff will come and tell me hey, you really ought to go see. See, I don't have to hit a quota. Go see so-and-so. I don't see children, one-on-one, because they have child services comes in and visits with them because it's school and everything. But very often I'll meet with the parents. You know, like 15 and down, I don't, but, you know.
I'll add on too and just say, there was a picture of you on one of those slides standing next to a blonde woman. That is Devin, another one of our peer visitors, and she's what we like to call a trauma mama. So her daughter was injured in a car accident and actually burned as well.
And I worked with her too.
Yeah.
And that's how Devin got involved. I was working with Devin.
Yep. And but the mother comes as a peer visitor. And it's interesting. I mean, it's very different than having a trauma survivor come as a peer visitor because she just has a completely different perspective. You know, she was the one at the bedside for the whole time, and she's great with those families that just, you know, hover over the bedside for hours and hours and hours and need to take care of themselves. So just another thought.
Hovering is a good point that you brought up for you people that are volunteers, as far as that's how I kind of sort of start working with families. And especially I remember because it was Devin. Every time I went by to see her daughter or even walked by the room, she was always standing on her feet rubbing her daughter's brow. And I called her out and I said, you have to take care of yourself. She wasn't eating, she wasn't sleeping. You know, I said, you're not going to be any good to her when she gets out of here if you're a frail mess. And something, I don't know everything, but she perked up. And, you know, you've got to take care of yourself. You got to tell them people they love you. They love the person that's in the hospital, you know, with you people too. But we sometimes have to remind them, you got to take care of yourself too. So, but she's been wonderful about being and getting involved in a program. It's you know, sometimes it just clicks, and it just, you look forward to going back in and meeting with the family and everything. And I tell them sometimes when I get them to laugh, I said, that's the most important part of your recovery. You're smiling and you're laughing already. And I said, I want to see you again, but I don't want to see you again. And they look at me and I said, I don't want to see you there again, but I want to see you again. And the craziest thing is, I'll close with this, is when I'm coming up in there, they have a clinic visit because the follow-up appointments for burn survivors, they come to the clinic, which is built on one other hallway of the burn unit. And I'm standing in an elevator with somebody, and unless they've got compression garments on, which compression garments, the raised spots on burns are called keloids or scar tissue, and compression garments help put them down, and you oftentimes see them on people's hands, or you'll see bandages on people. But seeing a patient that's been laying down sometimes for months and then have them stand in the elevator right next to you, hey, how you doing? I said, oh, yeah, good. I have in a full year, because of the hit this last year, I think I saw 127. I've seen up to 230 visits, not people, but continued visits up to 200 a year. And right now there's just Kirk doing that on the burn unit. We're trying to get, being the only burn unit in the state, I have somebody that like really wants to do it that lives in Williamsburg, and somebody was in Elizabeth City and they moved, and somebody now that really wants to do this thing lives in Charlottesville. So the logistics and the mileage are causing a problem there. But you know, I'm not going to go out and recruit people and say, how about getting in the house first so you can come? That makes people laugh sometimes. Sometimes humor is good, but making them feel comfort is another thing. I wanted to say this the first time. When I go see a patient, I always try to find out where they're from, because that's my icebreaker, is I go in the room and find out where they're from, because very, very often a patient not talk about anything but what put them in there, because it's all about making them feel at ease with themselves. And if they can see that you're at ease too, when you're going to get somewhere with them. Thank you for letting me speak. Thank you for having me tonight.
I want to thank Kara and Kirk for being with us. This was very, very informative, and we're so glad that you took the time to come and speak to us. And much of what they said, we can put into practice ourselves as visitors and as members and as caregivers for people that we know who are living with heart disease. We have a little memento so that you can think of mended hearts whenever you use this.
Very
We
sweet.
thank you so much.
Great.
We're going to take a little bit of a break, and we invite you to join us, you're welcome, for some snacks. And maybe people have individual questions they want to ask you.
Great.
Don't have to stay long, and if you have to go, we certainly understand. We'll take about a 5-minute break, get something to eat, and we'll resume for the business portion afterward.
Thank you for having us.
Well, thank you. This was very, very
We've been
informative.
talking about it for a while. I'm glad it finally came
Yeah.
to fruition.
Very good.
Kara, could I take a picture of you and the current
Sure.
there?
Yeah.
Maybe standing on either side of our men's house
Yeah.
banner over here in the corner. I did a quarterly newsletter and helped them make pictures.
Oh, sure. Yeah, yeah.
I've got a little bit more.
Okay.
No, I'm fine.
No. Let me check again to make sure I did it right now.
Oh, good. I'm glad. Yeah.
Next time I'm on campus, I might stop by and just visit. see
Do
what's
it.
going on.
Yeah, absolutely do it. Yeah.
Thank you.
Okay, one, two, three.
Very nice, but it's kind of, it's kind of a granddaughter, but I'm still on the paintings, and so they brought us something.
Go cross-eyed, eyes closed.
Oh, that's terrible. That's fine.
Get out of here. I doubt I can look any better than that. You better just go ahead and keep that one.
I like this one best.
That's fine with me.
I like this one best.
Sure.
Thank you.
No, that's fine. Thank you very much.
By the way, do you know, Dennis,
Dennis and I visited VCU Wednesday.
have I ever met you out at Shelter Arms?
Yeah.
I thought I did, because Dennis and I go way back. I knew Dennis before, well, Dennis had heart trouble, probably.
It must have been a little different.
He's had 20 years of.
Yeah, well, I knew Dennis when my daughter, my daughter is 35, and our children swam together. Probably at least 30 years ago. At least, that's how long I've known. Well, then, he moved away. He was going to the same church I was in, and I knew him from swimming, and I knew him from being in high school. And then ran into him. So it's a small world.
Well, one thing is, I want to say, you take care of yourselves. He tells the story, after he got that back, some years ago. And at one point, his daughter was there, and the emotions were over, and says, if you get this other stuff up there, everything's bad.
Yeah. Yeah, that's what I remember most about my
Well,
mom.
and the other thing is that when I was in there, I still remember, you read faces, and I remember writing when I was pregnant to my mother, tell Daddy not to worry, because he's not worried. Yeah, it was like, and then later on I said, I figured I was in bad shape, Daddy was worried.
Yeah, really.
And I said, tell Daddy don't worry, that's the call the mom and dad. But yeah, I know it was exceptionally tough when everybody was tough when I was being a nurse. She was a PR.
Oh, it's hard.
Oh, yeah. Every year during the holidays, Christmas coat he wears.
That's great.
Imagine walking down the hallway of the hospital.
Oh, yeah.
We're regional VCU, and everybody goes, I love that. I love that. I know,
He's a business.
It makes a difference. Yeah.
How many different hospitals do you guys go to? I heard y'all allude to when you were out there, that I went to a lot of different. I really appreciate
Yeah, I would love to have some rice too, but
White rice, white bread, white potatoes, do not eat.
That was about a year.
I will have a little bit of bread down
Thank you, sir. Where were you, law enforcement officer?
No way, you leave me before you finish school.
Yeah.
Very disappointed.
We have, matter of fact, Frank Beamer, head coach of Tech, as a child, he had a boiler furnace blow up, and you could see where Frank Beamer, coach was getting into. He had, well, they obviously did draft, but they rebuilt the boiler. As a matter of fact, they got me to play years ago, and Gary Green was holding me playing this ball. It's not easy, I think, to get a hold I mean, she had.
Oh, goodness. Same here.
Well, you know.
Oh, well, 2 on each.
They told me that they waited till I was 45. Back then, I was 25 years old. And they said, you know, that was the last, you know, I just simply got out of bed one day and
now I look at the bike and say,
you know, I said, oh, you know, I have a high threshold, I have any. And,
right?
that's when the doctor did tell after he saw it on that.
I saw your X-ray. You sent it to me.
I know.
I'm like, how are you looking?
The ball, the socket was in there, and the socket, the screw came out, so the socket had turned, and the ball was sitting on the lip of the socket.
Yeah, I don't know how.
And for a while it was unbearable, but I think it was sitting on there. And then it shifted around, so then it was just mildly unbearable. You know, it's like for me, what might be a 7 or an 8 on the scale, I was told was probably a 2 or 3. Just the way it is. Like when I had my ankle fused this time, 25 years ago, I had to hit on 6 months later, because of standing like this. I didn't want to put weight there. They put 3 screws. 2 years ago, my foot, 13 screws in place. So they fixed it right this time. But it's not hurt.
But the main thing is,
Oh, yeah.
Exactly.
We're still good. I think I'll just get a little shot of that.
Of course.
Always
Right. So you try to do once a month? And you meet here, or you work it around your friends? And you know, Shifflett, no, Shifflett has contracts that work there. I don't know to what extent, and this hospital just joined, I believe, they all just.